Hi, my name is Paulien Melis. I'm lab lead of Make Health Lab at WAAG, Institute for Art, Science and Technology in Amsterdam. And I would like to welcome Jorge.
Oh, hi, Paulien. Nice to meet you.
Nice to
My
meet
name
you
is
too.
Jorge, actually. It's difficult to speak this. Yeah, that's okay. Yeah, I work here in Rio, Brazil. I'm a professor at the PUC-Rio, the private university, and also a researcher from the Science and Technology Ministry in Brazil.
Nice. But besides your professions, you're also very active in the maker field at the moment. And before we dive into that a little bit more, I think it's good to start by saying that the whole maker community worldwide has stepped up when the COVID-19 crisis reached out to the world. I think it's amazing to see how in an instant of a moment people felt the urge to put in their design skills, their maker skills, their facilities, and in starting to create these responses, and reached out to healthcare professionals, the hospitals, healthcare centers to support in any way that is possible. And I think it's also very great to see that this is something that a larger consortium of maker spaces and universities and a tech partner is already working on. It's called Careables platform, where we envision and support people with healthcare questions, healthcare professionals and makers, together with designers, to co-design and co-create and develop personalized solutions. And I think now it's this type of collaboration has gone worldwide, and everybody stepped up. But yeah, please explain a bit more what you've been doing the last couple of weeks.
Oh, thank you. We started to. I was invited for a meeting at the government, state government here in Rio, on March the 13th, I think. And then when I went there, I met some physicians there, and they invited me to go there to talk about digital fabrication, to ask me what was possible to do by using digital fabrication in the case of emergency. And I explained about, which kind of technology we already have in Rio and this kind of things. And then as soon as I left there, one of my PhD students, he's a physician, and he started to make some phone calls inviting different physicians. And I started also to make, to call many friends from industries federations, from makers movement, many makers, and also universities, public universities, private universities. Anyway, we kind of created this huge network very quickly in Rio. And on the same day at night, it was amazing, because on the same day we started to connect many people using WhatsApp, with different groups. And also I called some friends from Belgium, from the Unfold design studio, to know more about what was going there in Europe, and also some friends from Italy, some friends from Australia as well. And then we started to share files, different files. But then at that moment, it was kind of famous, those ventilator 3D printed tubes, something like this. And then when I was talking with the physicians here, they said, "Oh no, we have a different ventilator. This part it doesn't fit on our equipment." And then let's start to understand which kind of equipment we have. And then it was a very great meeting. Then I started to understand which kind of equipment we have, and from that point, or from that moment, it was very nice to see that everybody was so keen to participate and to help on this process. And there's something very interesting, because we have a quite different situation here in Brazil now. The peak, we are still heading to the peak, and yesterday was a very bad day here, especially in Rio and São Paulo. But then as soon as we created this group, there was a network television interview, and I went there to explain about this group. It was so interesting, because on the next day in the morning, we are talking about the March the 16th. On the next day in the morning, I got so many calls from different parts of Brazil, from Amazon, from the very south, from São Paulo. Everybody was, wanted to know how it was possible to connect different players, from government, from makers, from universities, different agencies. I think that was the interesting thing about this.
Yeah. And how did you know what type of things? Because you mentioned, hey, the pieces for the ventilators you were making, but there were many more things you started making and producing. How did you manage to get the demand and the supply in balance?
Right, that's a good question. In our university, we have a quite great workshop structure with so many 3D printers, and then everybody was sharing files and discussing files, and I thought, let's wait a little bit. First of all, let's ask the physicians what they need, what they want, instead of start to print out things, and that was the best decision here, because then we started to understand the necessities, and then of course, as everyone, we started to also print out face shields. It was a kind of everybody was printing face shields, and then when we reached a very great level with face shields, then I spoke with the industry, saying, "Oh, now with the makers, we can print out, let's say, about 200 a day, but then we need thousands. Yeah, we need thousands." And then it was nice to involve the industry in this process. But at the same time, it was great to see the makers helping, because then the self-esteem of those many makers was so high. It's still very high, because they can collaborate on this moment. But then it was possible to join those two different paths. The first was the makers movement, and the second one, the industry. Then if we want, we can reach different clinics, different physicians, and with the other one, it was possible to reach policy, and
Was it difficult to get the industry on board? Because if you look here in the Netherlands, industry is stepping up, and for instance, one of the a bed manufacturer is producing the mouth pieces, but the collaboration with makers is still It's either
I
the
understand.
industry and not involving makers directly. So I'm always amazed in all the things that are happening in Brazil. And what is the magic?
Yeah.
What is the trick? How did you manage?
No, I think there's no trick. I think the same thing happened everywhere. And but the interesting thing here is that things are made by people, no? And then if you know people, you know exactly who you need to call. And with the industries, it was great that on the first moment I called a friend who works in the industry federation here, and she's the manager of innovation department. And she was very keen to. She said, "Oh, George, okay, let's do this. I can join the industry. Let's." And then I think things are made by people. You have to know the correct person that you have to call and explain that we are in the middle of emergency. And but of course we are still having some kind of different problems in these connections, because and then every day I have to the guys are they call me the fireman, because I have to find a solution for this kind of problems between industry and makers, because one is very fast, so different time difference, but at the end they're all working together at this moment, and this is the best thing, I think. But the first thing that we have done here was I invited the industry federation, and that was the tricky solution, as we can say.
Yeah. Hey, and one thing you pointed out at the beginning, you said, hey, before we start making, we need to talk to healthcare professionals, to the physicians, to know what they need. Do you think that's also a key to the success, that and the proper effort that you are putting in place right now?
Absolutely, yeah. Because I'm a designer and I work in the PUC Rio, the university, and I really believe on transdisciplinarity. And as a designer, I have some PhD students who are physicians, and then I invited one of them, and he invited also many other. But then it was nice to talk to them and try to explain what exactly it was possible for us to do, and also it's a kind of bilateral talk, because we need to know exactly what they need, and they need to know exactly what we can do. But it worked very, very well, actually. Like 2 weeks ago, we started to work on the laryngoscope. And then, again, some infectologists call me, George, we need to do something for this laryngoscope. I know that I found a file, I got some file from internet. Can we do something different here, because we have a different camera? And I said, of course, let's do this. And then he invited another 3 pneumologists to discuss about this. And then we solved those files very quickly. And then we start to print out then to share. And but the physicians, I think they are the most
crucial.
important point at this moment. Crucial, yeah, absolutely,
yes,
you're right.
I think so. I think so too. I think it's the same here with the European initiatives.
Sorry. Sorry, there's something quite important about this, because when it was, well, we are in the middle of an emergency problem, but in the beginning, everybody was trying to find the rules related to every product, and then one of those physicians told me, George, we are in the middle of a huge emergency. Let's do this. Let's print out many, and then we can decide which one is better for us, instead of waiting for to know exactly what are the rules to do the things, and that, I think, is a quite important point to be addressed, because they decided and they told me to, forget about the rules now. Let's do this, and then we can follow the rules.
Yeah.
The rules are
Do you
important,
have products?
of course.
Of course, yeah. Well, especially since it's equipment that is a matter of life
Health
and death.
equipment, of course.
So yes, so in a way, we do understand, and I think the same is here as well. That some kind of validation or, proper check of the maker-made solutions is really, really necessary. And you saw that,
of course.
In Europe, there was the lifting of regulations. So, but still, it needs to be checked, and some validations need to be done. So we in Europe, or at least not in the Netherlands, we didn't see that physicians or hospitals said, just bring in and we'll do the legislation and the validation afterwards.
No, I'm not saying that they gave us the validation. I'm just saying that we have different levels of validation. If you're talking about a ventilator, you have a very high level of validation.
Definitely.
But if you're talking about the face shield, it's a completely different. And then we have hundreds of different face shields. And then we print out about 20 different models, and the physicians decide which one was better, because sometimes the rules are not, some things are working well in Europe, some things are working very well in United States, but sometimes we have a different situation here. It wasn't an official validation, but they told us what was better to do at a certain point.
Yeah. Did you also, or are you in contact with a lot of other maker groups and so on worldwide, or is it really the network in Rio and Brazil?
Yeah. This network is working very well in Rio, right? And we have sent many files, and we have explained lots of things for different states in Rio, in Brazil. We have to remember that Brazil is a huge country. And
Sao Paulo has even more. Sao Paulo has even more inhabitants than the whole Netherlands.
Yeah, it was interesting also to know that as soon as we started this in Rio, because in Rio we have this community, and then we can talk very quickly. It's quite. I just have to, make a phone call to invite someone to come. I think this is a kind of Rio ambience. But then, as soon as we start this, I got some phone calls from friends, researchers, friends from São Paulo, asking, how it was possible for you to connect the industry with the makers, and it was, and then I thought, wow, come on, São Paulo is a huge city and huge state, but it was interesting to start this in Rio. But I still have connections. We're still doing many discussions with some friends especially from Belgium, especially with the guys from Unfold, and some friends in Milan as well.
Yeah. Okay, that's good to hear. What are the next steps?
And from Netherlands as well. I have relatives
of course,
in Amsterdam.
Okay, good. Hey, but what are the next steps for this network? Will it continue? Because now we're in a crisis and there's a need for emergency. But I can imagine this type of collaboration to continue.
Yeah, that's a This is a very good question. We are still doing lots of things, but now as this collaboration is non-official, which is absolutely amazing, there's no document signed so far. No buyer signed any documents, which means this process is fast and great. And then there are so many people doing things, and there's no centralization of this process. So from now on, I'm working now on some public calls to get funds to help those process. And then in Brazil, especially in Brazil, if you need if you want to get funds, public funds to support projects, you have to have a PhD and this kind of certifications. And that's why now I'm working on writing public calls to try to get funds to buy material and this kind of things. But the network's going well, and we are, of course, I think as everywhere, we're discussing now what's gonna happen from now on in terms of digital, files, digital this. How can you work from home? Everything's different, but especially in Brazil, because the difference in terms of social, it's so high, and we have to find a better way to help people and find solutions for our people.
Yeah, but I can imagine that this work and this collaboration is also really a best practice or an example to be continued afterwards when different type of products needs to be developed, rather than the face shields in this way.
Yeah, absolutely. They asked me about this before, because there's likely question when joining makers with industries, because then we are talking about how can I say this in English? Confidential files, then if you have to share files, is something that it's not so easy when we are not in an emergency moment. But we have to find a way to do this, because the makers are so fast, they are so quickly doing things, they just do, and this is amazing.
They're used to stepping up, prototyping, just start, redo, reiterate,
absolutely.
go on. Yeah. It's amazing.
Exactly. And in our function, or in our university, was just to allow them to go to the workshop. There's a guy called João Vitor. João Vitor is the guy who's in charge of our production there in the university, and he told me, George, we need an allowance to allow many makers to come to the university and to bring their own printers. Can you do this? And I said, of course. And then it was, we kind of bypassed the bureaucratic system, allowing, makers to go to the university, even if they are not students, even that we just opened the access, keeping all the security,
Sure.
To know that they have to keep distance and these kind of things. But we have so many 3D printers now working there. People are going there. And then the university gave us authorization to use the restaurant for them to have lunch and dinner. And, we just, sometimes you just have to understand that it's an emergency, and then you cannot think as a bureaucratic person. You have to trust in people. I think the most important thing is to trust on them, and it's going well.
Yeah, Well, I hope at least, I don't know about you, but I hope that we can still maintain some of these bypasses or some kind of change in the system that allows us for this type of real rapid innovation and new ways of producing and also collaborating with industry, because and providing the care and facilities that are needed.
Yeah, absolutely. There's something interesting to also to highlight at this moment, Paulien,
Mm-hmm.
is that now we can understand how science is so important.
Yeah.
I think we started to think about science again. It's great. And also,
Yeah.
it was important for us, and probably for you as well, for some European countries as well. It was important for us to understand that we need industry as well.
Yeah.
We have no industries in Brazil producing masks. Can you believe this? Producing the fabric to produce masks, producing ventilators.
Yeah.
Every
Yeah.
At the end, everything needs to come from China.
China.
And then I think now it was important for us to understand that we need industries in our countries as well. Otherwise, you have to rely on always import things. And sometimes it's not easy to import things.
Definitely.
It was
The same here.
It
I
was
think,
a kind of.
Oh, go ahead. Sorry.
It was a difficult lesson to learn, but I think we learned this. We need industries here doing important things also for our countries. Otherwise, everyone needs to import things from China or different countries.
Yes, and I think because we need to move towards some kind of ending already, that it's also crucial that we look at these different and where production is taking place, but also the relation that this do-it-yourself maker community is of value and asset to and also as a I think it's also essential that they have the skills to adapt quickly to needs of physicians and the medical field, because the industry is of course they're doing great research, but in this type of situation, just rapid prototyping, like you explained, is so essential, and it's the, I think, the big power of and trying to create solutions is the big power and strength of the maker community and designers as well.
Yeah, absolutely. Yeah.
Some last words. What do you hope, or what do you expect for the coming future?
I was thinking about this last week. Things changes a lot in in our way of thinking, our way of interact, and I think that things need to improve in terms of virtual meetings. It was interesting that now everybody are using these virtual connections, different apps to connect people everywhere. But then we need something more, interactive, using, I don't know, happy devices or something that you can have on a 3D structure, a 3D virtual simulation. I don't know. I think lots of things are going to happen in this scenario, helping people to interact through distance, and also how the industry is gonna react if this situation, how the economy is going to react, and then I think at the end, I hope that especially in Brazil we can you can survive to this moment. Things are very difficult at this moment now here in Brazil.
Yeah.
But again, we have to be humble and understand that life sometimes has its own ways to
Definitely
explain things for us. Yeah,
true.
that's
Yeah.
it.
I think that goes for us as well. I think a lot of people are in very stressful and situations right now, and let's hope it's possible to find solutions there. And I hope also that the makers are really thinking, and designers are thinking ahead to create these new solutions that are needed as well. Not only now in the medical emergency, but also that we now have the stripes on the floor with tape to count the 1.5 meters between people, and we need to design new solutions and ways of interacting. So I think that's a call to action for the next couple of months. It was a pleasure
Absolutely.
talking to you, Jorge. George, sorry, George.
Yeah, it's difficult to say that.
Yes, keep up the good work, and hope to see you or meet you in another, either online or in another way possible. Thank you so much.
Okay, thank you very much, and nice to meet you.